music to my ear, the theme for the doctor on the line. And speaking about on the line, that's where we're going right now. Good morning.
Good morning.
Good morning.
How are you?
Good morning.
Yes, my name is Charles.
Go ahead.
Cheryl.
Yeah, I am attending the hospital because I have fibrosis. And I don't have the bleeding anymore because they give me a tablet for it. But I get a very bad lower back pain at all times. They don't need me. I just didn't know what's causing that because nothing is not fucking me.
All right,
Okay.
we're getting some
Really
feedback
bad
there. Please, when you're calling, don't stand next to the TV and certainly don't have the volume up. Did you gather much from
She's attending the hospital.
She has fibroids, I think she
fibroids,
said, but the
okay.
bleeding, the heavy bleeding she was experiencing has stopped because she got something from the doctor, but she's getting a bad lower back pain. She doesn't know what's causing it.
Well, the fibroids. The
Okay.
fibroids, especially since they're large, are pressing on the muscles and the vasculature of the abdomen, the lower abdomen, and causing some back pain. And it usually causes severe pain during the menstrual periods as well. No, I think based on the fact that she has had heavy periods and she has been on medication, which obviously only temporarily have ceased to relax, stop the problem, I think that she would need to have those fibroids removed sooner rather than later. If she's desirous of children or more children, or doesn't have any children before, I think that a myomectomy will be one of the things that should help her to stop that lower back pain, as well as to stop the heavy periods that she was happening, so she doesn't have to be on that medication to control the cycle as she is at present.
All right, hopefully that's helpful to you. We hope that your pain is relieved soon. We have Paul holding as well. Good morning, Paul.
Good morning to the panel. Good morning, doctor.
Good morning, Paul.
Paul, you're not, you don't have your television volume up, do you? If you do, please turn it down.
Yeah,
that is important. Okay, carry on.
Okay, I fell flat on my back on the beach some time ago. Made it home, but then could not walk for 24 hours. Did I hurt, and will it have any lasting effects?
Okay, are you clear
So,
up?
having fallen on your back, you may have had low back spasm. I'm glad that you were able to get home. I'm sure that you applied some ice on the area, 20 minutes 3 or 4 times a day, and not hot water and Epsom salts, because ice relaxes the muscles, relaxes the spasm, and allows you to be more mobile quicker, because it's anti-inflammatory as well. You would need to be on some anti-inflammatory medication, and you might need to have some physical therapy to treat that back to get you active again and to strengthen those abdominal muscles that may be weak and may have contributed towards the back pain.
I want to follow up on something you just said. You said you hope it wasn't hot water and Epsom salt. Some people suggest hot and cold treatment for areas that are sore. Should you?
No, ice is recommended. When I watch international sports, that's what I see people use. Ice is recommended, but Barbadians like to use the hot water Epsom salts, and maybe it used to work in the past, but ice has been shown to be more effective. It reduces the blood supply, reduces the spasm, and obviously reduces the pain. And after 20 minutes of use of ice, and you don't need any special commercial ice pack, crush ice in a towel or a plastic bag on the area, and that would treat the problem.
So is there a point when you use warm? Because, I mean, I've had hot and cold therapy for...
Well, the warm is used in chronic pain or old pain or arthritis, or after a few days after you start the ice. But in the acute situation, you use the ice because you need the heat to increase the blood supply to help the scavengers and other things that need to come in there to help to fix the area. So you need heat for that, but normally in the initial situation, the ice is better first few days.
All right, we should all invest in the magic spray. Let's say good morning to Donna. Good morning. Donna.
Hello?
Good morning.
Good morning.
Yes, good morning.
Go ahead.
I suffer from HTL1 PSP. I would like to know if there's any relief treatment for it.
Suffers from...
Can you repeat that, please, Donna?
HLP1 PSP. Tropical spastic.
HTLV1?
Yeah, tropical spastic paralysis.
Oh, okay, okay. And you want to know what?
If there's any relief treatment.
The treatment of tropical spastic paresis, which is caused by the HTLV1 virus, that is a specialized area, and you would need to have a combination of physical therapy and medical therapy, where you have medications to help to relieve the spasms that occur and the pain that occurs throughout the body. And I'm sure you're under the care of someone, some consultant at the QEH who would be better able to deal with it. And if you're having problems, you need to let them know, and it's a chronic condition that needs to be treated. It causes, a lot of discomfort in person. It's not very common, hence you may not have heard of the HTLV1 virus.
Well, perhaps we can get a little bit more on that, but for right now we need to go to Annette, who is holding. Thanks for holding, Annette. Good morning and welcome.
Good morning, ma'am.
Good
morning.
How are you all?
We're great, thank you. How are you?
I'm fine, thank you. This is my first time calling.
Welcome.
Thank you. I had a period for 2 days last month. I'm 43 years old. I would like to know if that is a sign of early menopause.
It could be, but it also could be a sign of early pregnancy.
Wow.
Yeah,
See, you made it go silent.
Question.
You made it go silent, Doc.
No, seriously, it could mean anything. I wouldn't jump to the conclusion that it's early menopause. You're 42, you're having regular periods all the time. You may not be having any other signs or symptoms to suggest menopause, but you need to rule out pregnancy as a possible cause, or it may just be a hormonal problem where the hormones are not functioning as normal as it should. Stress, other things can cause that. But don't jump to the conclusion that it's early menopause at all.
All right, we are going to invite Jeffrey, who's holding on the line. Morning, Jeffrey.
Hello, good morning.
Good morning. Good morning. Go ahead, please.
I'm just trying to find out. I have a tightness in my stomach, and like a pounding in my heart, and
Don't listen to your television set. Just go ahead and
What in the stomach she's having?
A tightness.
Tightness in her.
And her heart is pounding. And a pain.
And pain, well, that could be, a lot of people call the chest the stomach, and I feel it could very well be something in her chest. She may have some cardiac condition. We spoke about mitral valve prolapse as a very common condition, commonly seen more in women than in men, and diagnosed by echocardiogram. That is one of the possibilities. But a cardiac irregular arrhythmia, which is an irregular heartbeat can also cause that, or any other cardiac problem, or even heart attack could have caused that. So something that you should check out as soon as possible.
And our final caller holding is Diane. Good morning.
Good morning. How are you?
Well, very well, thank you.
I'm having problems with my hands for a little while. At one point it was trigger finger, another point it was carpal tunnel. But my fingers, the joints in my fingers, all in the palm of your hand, they're very painful. How can you tell if you are having could it be rheumatoid arthritis?
That is a possibility, and that can be determined after full history taken by the doctor and physical examination, and then there are x-rays that can be taken, as well as blood tests that can be taken to confirm whether or not you have rheumatoid arthritis or some other type of arthritis, or exacerbation of your carpal tunnel syndrome or some other condition.
Okay. All right, so we're talking with our doctor on the line, but we're going to pause for a cause. So we have our first traffic report for the morning.
Morning Barbados traffic report brought to you by Sani Services Limited. Clean air in your office is our concern.
3 away from the hour of 7 o'clock. We'll have another update for you shortly, but just a quick update. Good morning.
Good morning, listeners. Road conditions this morning are right across the island, and we're still seeing light traffic, however. Highway 1, 2, 3, and 4, traffic is more light coming in towards Bridgetown, no major problem. Highway 5, 6, and 7 as well. Smooth and easy traffic. We do not have any accidents for that this time, however. Just cautioning motorists to be careful because the roads are wet as you make your way into the city. So until my next traffic report, I'm handing you back to the studio.
Thank you. Thank you very much, Constable Aline. We will check in with you again very shortly.
Morning Barbados traffic report brought to you by Sani Services Limited. Clean air in your office is our concern.
Well, this is where we say thank you so very much, Dr. Lord.
Thank you.
Quick tip for the day?
Well, eat properly, eat regularly, and it's a mango season. Don't overdo it. Don't overdo it. All my diabetics are in trouble.
Yes, my mother was asking.
One mango.
All I can say, Doc, is that we would not be overdoing it because
Cassandra keeps forgetting to bring our mangoes.
They're not here. So
What
there's no
gonna tell
chance
you?
of us overdoing it.
Dr. Lord, I'm trying to keep my mother away from them. And she too is asking God for strength to help her control herself. So, Colin?
I think it was mango in the Garden of Eden, though.
Not the apple.
Yes.
It's a
So,
wonderful
Doc,
fruit.
thank you as usual for dropping by. Look forward to
Thank
seeing
you.
you next week, Wednesday.
Thank
Sure,
you.
definitely.